From the News Channel 5 Network, this is Inside Politics.
Hello everyone, I'm News Channel 5's political analyst Pat Nolan. Welcome to Inside Politics. Today we again continue our conversations with the men and women who would be our next governor. Our guest today is former Nashville Mayor Karl Dean. He's running for governor in the Democratic primary on August 2nd. Mayor Dean, welcome back to Inside Politics. Good to have you back on the show.
Thank you, Pat. It's good to be here with you.
And we're beginning our interviews with the questions that we're planning to ask all the candidates. The first question is a pretty simple one, but perhaps the most important question to ask any candidate. Why are you running for governor?
Well, I've always, most of my adult life has been spent in public service, and I've enjoyed that, and I feel like it's a good way to make a contribution. But I'm running for governor largely because I'm convinced that the people of Tennessee want a pragmatic, common sense, sort of get it done governor who's going to focus on the issues that really matter to people. I don't think that the state is looking for an extremist or somebody who's going to look at everything through ideological lens. They want somebody who's going to actually do things that will move the state forward. And I think my training as mayor, where I ran for office in a bipartisan election, had to get Democrats, Republicans, and independents to vote for me. And then when you run a city, you don't do it on party lines. You do it on what you think is going to be best for the city and how you make the city a better place to live.
As you go across the state, what have Tennesseans identified for you as the three most important issues facing the state?
I think number one is education, and I would say right now probably health care you hear a lot about, and then jobs. Tennessee is going through a period of prosperity, but it's not evenly spread across the state, and it's not evenly spread even in areas where there is a lot of prosperity. So people want to see more done to bring good jobs to Tennessee. In
terms of education, are they concerned that the 10 Ready Tennessee testing thing doesn't work very well? What is their biggest concern about education?
Well, I think the voters are thinking about education on a pretty broad level. I think things I hear are that they definitely agree with the idea that we need to be a state that produces more college graduates. But people are very interested in us looking at vocational training, technical training for those who decide they're not going to go to college. You know, one of the things we have to do, I think, is have a pathway for folks who don't choose college to be able to get good paying jobs. So I'd say those are the two big concerns. Disparities in funding, teacher pay would be up there, and 10 Ready, the testing, we do hear a lot about that. You know, and the concern there is that I think people think there's too much testing, but they're also nervous about the fact that it hasn't performed the way that people expected it to, that there's some concern whether the results are accurate, and there's some concern that the results are delayed to the point where they're not useful and actually working on the next year.
You mentioned health care. Virginia has now become the next state that's going to go into expansion of Obamacare, as it used to be called a lot. Tennessee has not gotten that way. Virginia only went that way, it appears, because of what they had in their last elections, where their state house almost turned around completely between Republicans and Democrats. Even if there's a new Democratic governor, what difference is that going to make without major changes within the makeup of the legislature?
Well, I think it'll make a huge difference. I actually think that if voters want to see Medicaid expansion and see folks have access to insurance and stop all these hospital closures, voting for a Democrat or somebody like me who's an advocate for Medicaid expansion sends that message. I mean, the polling on this, at least that I've seen, is that the voters are for it. And I think you can look back now at that decision that was made, and I think it was a highly partisan decision, was a wrong decision not to expand Medicaid. We've lost $4 billion. We've seen 10 hospitals closed. And we've put ourselves at a disadvantage in terms of other states, in terms of the amount of Medicaid money that we receive.
One of the things that Governor Haslam and the legislature did this last term was to tighten up on the opioids in terms of the amounts of prescriptions that are allowed, in terms of numbers of pills. Governor also put about $30 million into treatment and care and enforcement. Are those baby steps in your mind? What else do we need to do to address this scourge?
Well, I think that the money that was put into treatment should be more. I think one of the ramifications of the Medicaid expansion, or the failure to do that, was, we're behind when it comes to treatment facilities. I had the opportunity to visit Renewal House here in Nashville recently, which works with mothers and pregnant women with addictions, and they have a waiting list of about 50 people, I think, and they're just, we don't have adequate treatment, and I think there's a consensus that we're not gonna, the way to get out of this is to have treatment. So I think we need to be doing more there. As for the restrictions on prescriptions, I think that was the right thing to do. I mean, obviously there will be probably some nuances that they'll need to examine as you go on and work with the medical profession on that, but that was the right thing to do. And I think we also need to look at law enforcement, because law enforcement plays a key role. There are people who aren't using these drugs but who sell them illegally and are getting rich off of the sufferings of others, and I think that there's obviously a criminal element to this too.
You mentioned that some parts of the state are not sharing in the boom that we're seeing across other parts of the state. That's usually the rural areas. You're the former mayor of Nashville. Nashville's been doing very well. How are you able to convince voters in rural areas that you're going to pay attention to them since you're coming from the big city?
Well, I think, it's like anything else. I'm running to be governor of Tennessee, not the governor of Nashville or Middle Tennessee, but of all of Tennessee. And so the concerns of every Tennessean is important to me. And I think the issues that we're talking about, education, jobs, and health care, are the ones that concern them. I grew up in a small town that was depressed, and I get it. And I was mayor during a deep recession, and I get that. And I think that I understand their concerns. I'm very concerned. You have 15 out of 21 counties in West Tennessee that are losing population, and that needs to be changed.
We have a situation where a lot of the candidates, particularly on the Republican side, are talking about not only their rural roots, but in some cases being farmers. Do you get your hands dirty? Do you go out and plant things? Are you a gardener, or have you ever been involved in an agricultural lifestyle?
Well, both of my parents grew up on farms in Illinois, and so there's farming in my background. But if there's a plant to be planted, I will do it when my wife tells me to. I'm not going to pretend to be somebody I'm not, but I understand the issues in rural Tennessee. And as I say, I grew up in a small town. That's the kind of life I know. And I think those issues are ones where you don't have to be a farmer necessarily to understand them. I think the past governors have certainly shown that.
Karl Dean is our guest. He's the former mayor of Nashville and the candidate in the Democratic primary for governor on August 2nd. Back to continue our conversation with Mr. Dean after this break.